I'm here with Bjorn von Siemens in our next ScaleApp podcast. I'm Dan Eisenberg, and I'm going to ask Bjorn to briefly just tell us who he is. So tell us who you are, Bjorn.
Ben, it's a pleasure to be here. I'm an entrepreneur in the surgical technology space. Originally wanted to be a surgeon, and then after 10 years of trying different things in healthcare, landed in a very fortunate position in the US of getting to know the technology ecosystem, saw the emergence of platforms, and thought that would be something very valuable to bring into surgery.
Great. Just a quick word about where you are right now, where you grew up, went to school, briefly.
Sure. I was born in Berlin, actually in the American sector, so grew up around the US culture, but German Swedish by origin. Spent most of my career outside of Germany in the US, in Latin America, in Asia, and in the UK. And that's where also right now I live. So I'm here based out of London, but leading Caresyntax, which is a US company based out of the Bay Area, and with strong operations in Europe, Middle East, and Americas, of course. And yeah, I have two daughters, and so far two full-time jobs. Three, actually.
Yeah, I understand that completely. And so in a very short, as much as possible, because Caresyntax is nothing if not complex, at least under the hood. Can you give a simple, understandable description of what Caresyntax is today, and perhaps where it's going?
Caresyntax today is a co-pilot for the surgeon. It helps the software, let's say it's a software solution, the data solution that helps the surgeon make better decisions before, during, and after the surgery. And by doing that, by being in the clinical workflow, we're collecting a lot of data that is valuable for the hospitals and for insurance companies and medtechs. But in its essence, it's making the surgeon and the procedure more efficient, more safe.
That's exciting. By the way, I think we should say that there's you have a partner, right, who co-founded Caresyntax with you. Could you just say a little bit? It's an unusual founding story. So say a little bit about the story, because I was actually involved a little bit at the early on. I got to see how it evolved, but give our listeners a little bit of insight.
Yeah, I don't know if it's that unusual. I mean, we met at a business school, at Harvard Business School. We did a field study together with a professor and did a top-down analysis to come to the conclusion where this kind of tech is needed most.
The we being Dennis Kogan.
So yeah, that is Kogan and myself,
Yes.
as a co-founder. And so Dennis and I met at HBS and did a study, and both actually, him and I have the surgical background. He comes from a 3-generational surgical family and has a lot of background there, and I had the original ambition. So despite the, let's say, top-down approach, the bottom-up desire to go into healthcare was what came out of the study, and that's what we went then on to do through a search fund.
So that's what's a little bit unusual about it. It's not rare, but it's unusual. You actually bought a company, right?
Yeah, we bought a series of companies, actually. So we did entrepreneurship by acquisition, and I think in healthcare, it's by now turning out to be the model that works. So the general catalysts and the larger investors and the successful investors, they usually start something and buy what they call a starter asset and build around it, just because the barriers of entry are so high to get to the first customer. And that's the strategy we followed with Caresyntax as well.
So we'll want to talk about two things. One is and they're kind of in a way contradictory or different from each other. Two perspectives. One perspective is how far have you come, and give us some idea in terms of numbers or range of numbers, whatever you can. It's a private company, so the information is, we won't get detailed information here. But then I also want to talk about the vision. But let's start with the reality, a rough idea.
Yeah, I think some of the numbers are maybe just starting out. We started in 2010, 11 with the idea, so we're still around, right? That's first number, which is important.
Right.
Living longer than 10 years is not usual for most startups. I think it's only 5% or 3% or 1%. I don't know how many startups live for longer than 10 years. I think the second number is we're used by over 40,000 surgical teams and globally. So it's really a high number of users that the software has, and the adoption rate is when we install is 100%, just because we're in the critical, let's say mission critical part of the workflow in the operating room. And in terms of number of people in total, there's about 250 people between the US, Europe, and let's say outside collaborators on the development side. And we are working with large health systems, so providers, surgeons, and we're also working with medical device companies and insurance companies, and have a specific focus on a few clinical verticals: orthopedic surgery, robotic surgery, and anything minimally invasive that has high variance of outcomes. So more complicated surgery, obviously oncology as well, and neurosurgery, cardiac surgery. So everything that is very complicated and has a higher risk is where we matter most and where it matters most, and that's what we focus on.
And you're in thousands of operating rooms, or at least 1,000 operating rooms, right?
Yeah, exactly. We're in 4,200 operating rooms, and it's a very high number. I would say the number is a little bit, let's say, to be viewed with a differentiated prism of how much of the platform is installed. So I would say that probably around 1,000, the number that you mentioned, are using more of the platform in terms of before and after, and the edge and the cloud solution. But the edge IoT solution is installed for 1,200 rooms, and the broader, let's say, value add that you can get from the solution is used by approximately 1,000.
And I think it's published. You've raised a lot of money. I think the numbers are out there to some extent, right?
Yes, it's a very capital intensive business to get into and to develop, and I think that anyone that is in surgery and means serious business will know that it is a medical grade environment. So software, hardware, anything that you build has to go through approvals, and so it's a long path how to get there. And so we raised in the hundreds of millions of dollars of capital to build the company, and we are, since I would say 2.5, 3 years, really in scale up mode. So doubling our revenue year over year, and growing to kind of significant scale in terms of top line or have reached that about 2 years ago, I would say, and becoming really a category leader over the last year or so.
Okay, so here's what's a little bit crazy, and I want to figure out. You're you're playing in with giants, right? You're in the field of giants. The medical equipment providers, the Medtronics in the world, some of whom are your partners. You're in the middle. You're playing with the small company. Still, 250 people is in this context a very small player, physically small, let's say, and you have a very big vision. This connected platform. So say just a couple words about what a connected platform is and how you intend to be one, and then how you manage this as a small company being so mission critical. I mean, people are trusting your lives, surgeons trusting their careers on you.
It's very difficult balance to strike, and as a small company particularly, we have to be the best in just one thing. And in this case, because we're surrounded by all these larger companies, we have only few advantages, and one of them is being flexible, innovative, and all these nice things that you can do as a smaller company, being quicker with innovation to the market. But more importantly, we are procedure and vendor neutral. So that means really we can provide a pretty unique, say, combined view on the patient, and a value to the hospital and the surgeon in not having to train their staff on, let's say, a dozen different systems from different vendors, but really have a unified cockpit and a unified data view on the surgical record. And that is a USP, and that is a pretty sustainable differentiator vis-a-vis these giants or these companies that are around us. The other differentiator is that we really have won the trust of the hospitals pertaining to giving us data rights. So we have secondary data rights, and we can utilize them to improve the practice, to help the hospital on the one hand, but also to improve medical devices in terms of medical device companies, in terms of running clinical trials and improving, let's say, the outcome efficacy or efficiency and cost efficiency of their devices. And that is very, very valuable for the giants that you mentioned. So they're our largest, or becoming our largest clients, actually, in terms of users of the data and buyers of the data that is generated by the system.
So talk about the platform, because I think in some ways what you refer, I think it's connected platform is the term, is in a way the answer. It can be small but extremely important and critical. Explain what that means.
Yeah, it's the end vision, and the big vision is to have precision medicine in surgery. That means individualized surgery. For every patient is different, has a different history, and at the moment, in broad strokes, we're in therapeutics, especially in surgery, doing a lot of very, very similar things to very different, let's say, patient populations and subpopulations, and making sure that the appropriate site of care, choice of surgeon, choice of device is done before the surgery and analyzed and risk analyzed before the surgery is a first step that we can support with data and with, let's say, just deploying smaller algorithms, small AI that is fed by analytics that researchers have long time already found in academic publications. So kind of compressing the time to bring innovation to market and bring the knowledge to market is very efficiently done through our system. And then during the surgery, we're really supporting the communication between the team and the surgeon, and making sure that everybody understands the next step in the surgery and is kind of following protocol, so to say. And by doing that, by ensuring that everybody is in sync, we can really create this. I think one of our surgeons actually described it as playing in an orchestra that is either coordinated or uncoordinated. And if it's very well coordinated, then the outcome is a very, likely a very good one. Whereas if not, which is in 80-90% of cases, the risks and the variance is extremely high.
I've seen some of the video snippets that you have, and it's almost science fiction. You can, in a way, put a graphic overlay onto the surgical videos in real time, right? That's one of the things that you can do, and you can actually show how the different surgical instruments are or should be positioned and collect information about it and give feedback on the one hand. On the other hand, you can sort of track everybody in the operating room and everything in the operating room as it moves around and provide information about that, and of course see whether it's going in the right direction or not, right? It's almost like, so this really is an orchestration of an extraordinarily complex process. At least that's the way it seems to me. I've only been on the other side of the knife. I have never been on the holding side of the knife myself personally. So let's talk a little bit about some of the challenges that you've had in getting to where you are, which is different. And I've been involved in one way or another. I'm a disclosure. I'm an investor, a serial investor in Caresyntax over the years. And what have been some of the challenges that you've had in getting to where you are, then I think the position that you are is a pretty good one right now. You know who you are, you know what you're doing, you've gotten, you have a reputation, the numbers are looking pretty good, but it wasn't always that way, right? So,
It wasn't always that way, and the journey to finding ourselves and also finding out what we do and what we don't do has been an iterative process. And of course, in the beginning, the vision was big and the solution was supposed to be very large and cover everything. And I think with time, what we found out and with learning from others as well, and our senior advisors and people like yourself have been from the beginning on there and to support this and de-risk us, I guess, has been quite difficult in two ways. One is finding the capital early on for AI and surgery was near impossible, and we had to delete the word AI from our presentations in 2011.
that's hard to imagine. Now, you don't have it, you're in trouble.
Exactly. It's hard to imagine. We registered surgical.ai in 2011, and we had to kind of change it because people were saying this is never going to come. So I would say the capital wasn't there, and it was also not there on the customer side. And that was very frustrating because whenever you show something and you show a lot of value and the surgeon wants it and the hospital wants it and there's no one to pay for it, that is difficult. And so we had to overcome this kind of bridge. And I think the first ones to give us a break were insurance companies. And I would say the reinsurance companies.
Why?
Those were the ones that we saw and see the long-term risk and the cost of risk and the direct connection to the P&L of what we do in terms of taking risk out of a process that...
Why did the insurance companies trust you first, or reinsurance companies?
I think they didn't necessarily trust us, but they trust data, and they trust that you can collect very high quality data through IoT because they know this from other industry verticals. And so they were like very focused on this IoT aspect to do better underwriting, do better claims investigation and risk modeling. And since the OR is such a black box in terms of data, we were able to convey that this is a strategy that can lead to a very differentiated solution for insurers. And that was the first break that was given to the company, and that provided the first, I would say, scaling to decent size. Then we had a second challenge, which was COVID. And during COVID, there were very limited number of surgeries done, but also the hospitals, our core, let's say, first client group, obviously were occupied with something much greater importance and urgency and saving millions of lives and being there for COVID patients. And so those were 2 years of very difficult environment in terms of growing the business. And it was only after that, and I would say a few more iterations now in the market around where do we want to really be positioned, which is in the operating room, in the workflow of the surgeon and the team, and supporting them day to day, that this is really the core of the company. And that's where we originally come from. If you remember us being the system integrator and the workflow software originally, coming back to the core and really making that our product that receives the most attention and the most investment. That is what's really now driving the success. And I think everything around that, all the applications that you mentioned, a lot of it is not developed by us directly, but just fed by our data and then put into practice. And that is the key here. We are very pragmatic, and we want to be as close to the users and clients as possible. We are extremely customer-centric, extremely surgeon-centric, and want to solve the problems of the caregivers, of whom we have too little and who are overworked and really doing a fantastic job every day, but don't have the tools.
With all these, I won't call them pivots really because they're not really pivots. They were adjustments of various kinds, sometimes big, sometimes small adjustments along the years. Have you had to change the people in the company, and what has that been like? Either not changing them and having them be very, very adaptive, or on the other hand, having to change them as a small company and the challenges of doing that.
Yeah, that we have people that are there since the beginning and even that stayed on from some of the acquisitions. So we have some folks that have been around 15 years plus in the business, which is great. On the one hand, I think that there is obviously always a need to evolve for everyone and to to either graduate out of the position or into a new position at some point. So I believe in this concept of renewal, and that's how Dennis and I operate and how the board operates. We don't put egos first, or we don't put positions first, but really it's meritocratic and it needs to make sense. And so that's why there is new people coming in. But I think in general, since it's a long-term business and a long-term vision, most people, even if once they leave the company, have been with us for many, many years, and then they find something else or we find an agreement. So I'm usually pretty happy about for both sides if people decide to leave. Sometimes it's harder and sometimes it's unwanted and unwarranted. And I think the anomalies of the capital markets were a little bit driver of that in over the last 3 years, where money was free and we were asked some others to kind of go out and spend it in a way, and then you have to scale back in terms of people, and that is very painful and not let's say productive. But it was also our decision, let's say, to take in a significant amount of capital and deploy it in this way. So we have to own it, and I own it as a responsible leader, and learn from it in the future. So to really more carefully manage growth, more carefully manage the next steps of the business, and think really in long term. This is a company that's hopefully around for 50, 100, 150 years and transforms surgery in the long term as an independent, let's say, new next generation surgical company.
Let's talk a couple more things. I promised my listeners to keep this relatively short. So I want to just talk about maybe 2 or 3 other things. One is partnerships. You've got an impressive list of partners. And that's really hard for small companies to do, is to partner, especially in an area so regulated and so, let's call it scientific/medical, as the area that you are in, with so many professional considerations. How do you manage what's sort of your secret in attaining and leveraging these partnerships with big players?
It's one of the core, I would say, values of the company on the one hand. So we have customer centricity. I mentioned it already. We're very collaborative. So I think that this collaborative nature pays off. And after 5 years of being in the business, after 7 years, 10 years, as you said, there is a reputational element here of we don't leave our partners alone. We don't leave our customers alone, even if sometimes things in the beginning don't fully work out. And that carries a reputational element that has compound interest. So the result of that is that we have institutions, hospitals, and surgeons, of course, but also large medtech companies, insurance companies, tech companies that trust us. And that is very much at the essence here is a long-term trust and relationship with partners, and then basically creating what I would call a network effect between these partners, because we are, again, a small company in a very, very large market, in a multi-trillion-dollar market. And so we have to provide benefits to everyone that is connected to our platform and make sure that everyone gets a return on investment and becomes more profitable. And if we do this, and sometimes we do it well, and sometimes we don't do it so well, but we do it more often well than not. And then what happens is really this kind of magical flywheel where you get into a hospital and you help them improve, and then you help the insurance companies come in and the medtechs come in and also improve, and the surgeon and everybody senses the difference from before to after very vividly physically on the one hand because of the physical environment changes, but also from a content perspective and workflow. And that, of course, generates a very long-term trusting partnership that often becomes a friendship, and in a way. And it's not bound to personal friendships necessarily, but really friendships with the company, because they, them being the partners and customers, experience Caresyntax as someone that is innovative and that is available and that is there and listens. And that is very important in this extremely difficult to navigate surgical environment.
Oh yeah, it's a huge challenge, but I think as you have described it to me, this the vision and the opportunity of being a connected platform, such as Apple being or the iPhone being a connected platform or connecting platform. I forget Peter Thiel's exact term, but this as a small player without necessarily a whole lot of technology, some AI, but connect the values in the connection and the know-how of how to connect and become a platform also makes you extraordinarily sticky. I mean, you are part of the healthcare system, and I guess the vision of Caresyntax is to be an integral part of that system, especially as it pertains to operating surgery.
Absolutely. And I think the reference to Apple is a very interesting one, because there is no Apple in healthcare, and Apple has some healthcare apps, obviously, that are consumer facing. But I think within the healthcare supply chain, we're still talking about hardware and kind of linear approaches. And this platform approach of building something that is new and high quality and centered around the needs of the caregivers and the needs of the patients, but in high acuity areas, is exactly what Caresyntax is about. And it's redefining the value chain. It's making it much, much more affordable from a perspective of scaling surgery, because we're talking about a large number of the world's population without access to surgery. And even in our parts of the world, an under supply of surgery. So it's a luxury good, it's a luxury service. To scale it, we have to make it much more affordable. And that can only happen through automation and through, let's say, a platform approach with a lot of digital tools involved. And we're bringing that philosophy, let's say, into surgery.
So until now, we've been looking forward, and I want to ask you to look back a little bit for a second. You're now, let's see, about 15 years older, or maybe 14 years older from the start, roughly. And you have a meeting with the younger Bjorn, who's 14 years younger. What's the one piece of advice you give him?
I'd say don't compromise on core values and on core beliefs. I would say the biggest mistakes we've made, I think, have been in terms of compromising by either choosing a wrong partner, a wrong from a values perspective, not as a person or anything like that, but a leader in the company that doesn't have the same values, and prioritizing kind of competence over alignment of values. And those compromises have been and can be very costly in the long term. And so I think on choosing who to partner with, who to work with, less compromise and more, let's say, rigor. And then I think putting clarity over harmony. So really making things very, very clear and very, very explicit is helpful for the leadership itself of the company, but also for everyone in the company. And that's something that you may have also recognized the difference of how we're speaking about the business. Whereas in the beginning was very amorphous. Now it's very clear what we do and what we don't do. And that is strategy, and that is good strategy. And so I think these two things, I wish I would have had them in me a bit earlier. And that, that would have probably de-risked the company for our investors a fairly bit earlier than we now have done. But it is a journey, but it's still something I would have loved for someone to really tell me in the start.
Okay. And last question, we'll wrap up. What are you what's the single thing you're the most proud of?
The change to those principles. So I would say that I'm most proud of now not making these compromises, following the values of the business and my own values in terms of kind of true, authentic self of the company and myself, and putting clarity above harmony, although I myself do not like conflict at all. So it's against my personality to do this, but the aversion to conflict is not something that has, and I'm not talking about being verbally abusive or anything like this, but let's say making clear decisions, that is what I'm most proud of.
That's wonderful. So this is again Bjorn von Siemens, co-founder and CEO of Caresyntax. So thank you very much for sharing us your valuable insights and time, Bjorn.
Thanks, Dan. Pleasure is mine.